So, hello everyone, and welcome to yet another episode of SPAG Fin's D-Log series, Season 2. Today, we are here to discuss a topic which is of great interest to a lot of us because it really forms the core of the society, which is the wellness of our senior population. Aging to me is actually a celebration of life and health. And therefore, it is very crucial, for us to provide a favorable ecosystem, to provide that much needed support, with the right information, with the right resources to the seniors who are aging. It is very important that our senior population is not only living longer, but they're living a better life, a life of dignity, a life where they are feeling healthy, they are feeling loved and taken care of. We can see a lot of shift in a demographic shift that has a significant impact on our country's social, economic, and healthcare systems. The life expectancy is rising, and therefore the number of senior citizens is steadily increasing. According to the Asian Development Bank's development policy report, Aging Well in Asia, it says by 2050, nearly 20% of India's population will be elderly. According to the United Nations, the number of Indians aged 60 and above is expected to reach 319 million by 2050, which is almost 100 million up. It was in 2011, it was 100 million. So this is significantly higher than that. Now, are we ready to address the needs of this rising senior citizen population? Is our ecosystem ready? Are we empowering them enough? Today, we have with us two experts who can help us deliberate on some of the challenges that exist, some of the steps that have been taken in the right direction, and what more can be done. Therefore, today's webinar on empowering senior wellness, innovative integrated approaches to senior care and living in Asia is, I'm sure, going to be an interactive and insightful one. I'm thrilled to be joined by two industry leaders who can shed more light on this topic. So please welcome Ms. Nanki Singh, the Chief Executive Officer at ProTribe, a trusted provider of smart care for seniors, and Mr. Vaibhav Tewari, who is the co-founder and CEO of Portea, Asia's largest and fastest growing in-home healthcare provider. Thank you both for your time today, and I'm really looking forward to a great conversation. So first things first, why don't we start with, what are the challenges that exist today? What are the challenges that senior citizens face in India? Because once we understand the challenges, which I'm sure you are very, very well versed about, but for the benefit of our audience, what really are the challenges apart from the social isolation, apart from the inadequacy in access to resources, to healthcare facilities? What are these challenges that exist, and therefore, what needs to be done to address these challenges and help our seniors live a better life? So maybe Vaibhav, you could start first, and then Nanki, you could provide your thoughts too.
Sure. So thank you, Ritika, for inviting me here. It's a very, very interesting topic, close to my heart, and of course, this is what we do for a living, also as well as a company. So if you look at the elderly population in India, and you gave the numbers, right? And if once somebody is hitting 60, 65, probably now we are looking at more as 65 as the starting time rather than 60, because people are living healthier, and they are, of course, they're continuously working till at least 65. Quite a few people are working till that age. So if I take 65 as the age, and then you say, okay, now I'm out there when I'm not actively working, and then what are 2 or 3 things I look for? So one, of course, I look for engagement through the day. I think the single most important thing for elderly, what happens, they look for engagement. What they're missing is engagement, right? Whether with family, society, now how do I basically be with people from social perspective? Then what do I do whole day? Correct. So how do I engage myself? I mean, others come and talk to me and socialize with me and so on and so forth. But what do I do with my time? I have all the experience as an elderly, and enough people are very, very experienced, have gained their experience over a period of time. What do they do with that, right? So how do I engage? How do I engage through the day? What do I do? and how do I spend my time where I am productive and I'm useful for the society. I think what happens with elderly, one thing which, and it happens with quite a few people, when they stop working, they stop feeling useful. So what do I do to remain useful? So I think that's something which is very, very critical, just from an overall philosophical perspective. From needs perspective, I think healthcare is a critical need for elderly, because of course we are living longer, but we're also living longer with quite a few chronic diseases and so on and so forth. And of course, the ever growing numbers of cancer and other kind of diseases which people are facing. I would say that so people live longer, but people live longer with chronic diseases. So that's one thing. Then how do I take care of my health? How do I get the best healthcare facilities and healthcare support, more than facilities, to start with support? And second thing is that what do I do with my time? And then other needs will be there. It's like if I'm traveling, what my travel will be very different. When you are in 30s and 40s, 50s, and then you go to 60s, travel needs are very different. What you do is very different. So how do you basically consume services which are contextual to my age group, right? And as you were saying, numbers will grow very significantly, but so far we are still very small percentage. Elderly is a very small percentage of overall Indian population, right? India is still known as a young country and not as like as an old country. But if you look at basically 120 million, we have 12 crore elderly now. And 2050, you have probably 300 plus, right? So that's as big as current US size, right? So that's like from numbers perspective, is going to be significant numbers, right? So how do you use services which are created for the population? So I would say those are 2 or 3 things people have to look for. So how do they engage? How do they basically take care of their health? And how do they basically consume services and products which are made for that particular, for their segment, and not necessarily have to adjust and deal with what is available for others and use that. So I would say those are 3 key things which you could see are challenges, or basically opportunities from a business perspective, support perspective.
Yeah. No, I like the word opportunity, and I think you've left it at a very important point, that we need to understand their needs and customize solutions appropriate to them. It's not them who has to adjust to it. So I think that's an important point. And when you spoke about in ensuring that they feel relevant, ensuring that they feel useful, that brings me to another point which I'm going to kind of take up on in during the later part of my conversation. But before that, Nanki, do you want to add to any other challenges that you feel the senior citizens of the country are facing right now?
Yes, I think Vaibhav actually summarized it very well. The way, if I was to rephrase what he has said, is I'd really look at the senior population under 3 categories: wish, concerns, and joy. The wish, like Vaibhav rightly said, they want to be independent. They've lived all their life independently. They want to do things on their own. Their biggest concern is health and wealth, which the health includes comorbidities, right? 54% of our people, of our seniors, suffer from comorbidities today. That means one or more of the 4 horsemen, right? And the third is joys. People, places, purpose, right? How do you make continuously engage yourself? And I think this year's Seniors Day theme was about connecting people, right? On 21st of August, which was yesterday, right? It was connecting people. So I think the important part is to make the right connections. And I'm not just talking about connecting people to people. I'm talking about connecting people to what they need the most, right? So if their biggest concern is wealth, help them connect with the right fund manager, right? And if their biggest concern is disease, how do they get over chronic diseases? How do they manage it for better health? If they want to travel, like Vaibhav said, they will travel differently. They will not travel like a 20-year-old, right? So I think you have to make those options ready for them. And would love to talk more about it as we move forward. But you have to create an ecosystem for them, which is overarching, which takes care of, like I said, wish, concerns, and joys.
No, I think that's a lovely way to put it. And I think we will speak about the role of the different stakeholders, it is important to understand these buckets and see how we can make those interventions that can have an impact. But when I talk of challenges, Nanki and Vaibhav, one of the key challenges which I believe is access. Now, access to information, access to resources. So access is a big issue. We saw that the IRDAI has now introduced a new rule that insurers can buy health insurance policies even at the age of 65 years, which I feel is a step in the right direction, and it enables access for older individuals and enhances coverage for high risk health conditions. Any thoughts on that, and what more can be done to address this access, the issue of access, especially in the context of our senior population?
So if you see from insurance perspective, and that I think the new regulation is of course very welcome.
Yes.
And I always look at it basically from what is the market need. Then the market need is there, then whether it's regulators or the business will respond to it. I mean, we saw this. I mean, because I can give you an example. We are basically Portea is the first home healthcare company in this country, right?
Right.
And home healthcare was not covered as part of insurance. But when COVID happened, and of course need was very big, then at that time, home isolation was very, very critical to do because not everybody could find beds, right? And if you didn't have like a level 2 COVID, you don't need to go to the hospital. You can manage at home. And
Right.
RDA at that time also basically moved very fast and made home care as part of insurance policies, right? And now I think we are seeing tremendous focus on how to handle this basically new what is like a silver population, right? And we are seeing tremendous movement from government, from regulatory bodies, and everybody else also from overall ecosystem. And that's why saying, okay, now this segment is becoming large enough. And I think insurance as a you can say as a business or a service also has become a lot more deep rooted in India. It's not only LIC and only government bodies, public sector companies, also a lot of private sector has grown significantly.
Absolutely.
So then they can manage this particular segment. I mean, if you did the same thing 10 years back, maybe a lot of companies' balance sheet may or may not be able to support it, right? Today, even if the large numbers come from here, they can support it. So I would say when the market grows and the need arises, I think these kind of things come into play. And even we had done a policy. I mean, it's like, and because companies have been looking at doing it, we did a policy with Star almost 6-7 years back, which was only for elderly. So if you're 70 plus, you could take that policy and everything was getting covered as part of that. Of course, it didn't take off at that time for a variety of reasons. But fact is that insurance companies also have been looking at this segment and have been doing some kind of testing. Now with government and regulatory bodies approving it and saying, okay, it's good to go, I think this will pick up momentum. And of course, you see post-COVID, there's a lot of focus on making healthcare more affordable, making healthcare more accessible for people across the social strata as well across the ages. So I think this is something which will be good. Even I think government has come with some regulations around Ayushman Bharat covering elderly in the country and so on and so forth. So I would say this particular segment is getting the attention it deserves. Of course, very, very early days, and that will only grow because not that we are doing any service to this or we're doing any favor to this particular segment. It's also need for the society to take care of them, right? Because it's like an overall, and we are seeing that in Japan and other countries, this kind of thing is coming up and people are finding ways. So in that sense, we just have to follow some of those learnings. We don't need to create some of our own learnings, right? So that is, I think that's a very, very positive and welcome movement. And that will benefit everybody across the board. I think it benefits elderly. It also benefits ecosystem. It also benefits insurance companies, actually. So I would say that's a very, very good thing which the regulatory bodies have done. Of course, it has to be implemented and a lot of other fine print is there and everything. But I guess this will only move forward. So it's a big positive sign.
Yes, and like you rightly said, that the potential is recognized and we are taking the necessary steps. Now it has to be sustainable, which we see that it is possible now. Certain things that were initiated several years back, but today there is enhanced capacity with all the right kind of support. So I think that's a great thing.
Also,
And
if you see like people, sorry. Also, if you see from elderly population perspective now, the spending power is very different. In our head, elderly people are the people who are going and basically saying, I'll go to temples more and I will I will do Vanprastha and I go to sannyas, right? That's how the Hindu way of being has been, right? But fact is that enough people in their 60s and all are fairly active. They are leading active social lives, and they want to live the life to the fullest, right? So, and they have purchasing power for that. I mean, it's like it's very different 2 generations, 3 generations before, the kind of purchasing power they have and the kind of the people elderly are there who have purchasing power. So it's not only like it's not the favor to these people, also big enough market. If you can customize products for that particular segment, there's tremendous opportunity for companies to build businesses. I mean, I read somewhere that people are looking at fashion, which is for 50 plus and 60 plus now. You didn't hear this like in this country 20 years back, right? Fashion is for younger people. But there's enough and more which is happening for people
Yeah.
on their 50s and 60s now, because
Yes.
their taste will be very different, and the target group is large enough now and has enough purchasing power. So I would say also look at it as just from a new market segment perspective. Don't even necessarily look at saying, okay, am I taking care of them or no? Are you taking care of their needs, and of course, are you making business out of it or not?
Because only then it can be sustainable. So I think that's an absolutely fair point. In fact, I was attending a meeting just before this, and the person who was addressing the meeting, and she is at a very big post in a corporate sector, and she said, when I'm working, I forget that I'm getting old, and she is in her 50s. And I think that was a beautiful thing to say, and it was quite inspirational. So yes, Nanki, anything to add on that point?
Sure, I'll pick up 2 points that Vaibhav made. One was the Ayushman Bharat. In fact, yesterday itself in the Economic Times was an article that was put there by me. It spoke about access to healthcare, right? There we brought out 2-3 points. It was basically about the health insurance scheme that's been brought out for seniors. Like Vaibhav said, their issue lies in the fine print. Intent is all noble. For example, the government, when it allocated the insurance scheme for Ayushman Bharat, it only increased the allocation of funds from 7,200 to 7,300 crores. But they have also included everybody above the age of 60, right? Which means that your allocation of fund is not commensurate to the number of people you are covering, right? That's one. The second part is you have to have a meaningful framework. How do you plan to assist them? What is the allocation of hospital versus home coverage? How are we tech enabling anything? Are we giving some allocation to home and tech enabled service providers, which
Right.
will large load of hospitals, right? And lastly, I would say awareness and outreach for senior citizens to know what is available to them in the insurance coverage is very important, right?
Yes.
And the second part that I would like to pick up on what Weber spoke about was, yes, it is a great segment. It has its own ecosystem of possible businesses, but there are 3 challenges that we face over here with seniors. One is trust deficit. Second is shortage of talent in the sector. And third is price sensitivity, right? To build a business around these 3 is a Herculean task. And I'm sure Vaibhav knows that perhaps you better than me. So, we need all segments to come out there and support us, whether that's philanthropers, government, venture capital, good capital, long-term patient capital, our agencies that actually help develop the healthcare workers and the overall ecosystem to be supportive to this cause. And only then I think can we really get the potential out in terms of a profitable business. Because at the end of the day, either you are a not-for-profit philanthropist or you are running a business, right? And at this point, I think you're speaking to 2 people who are trying to run a business. So yes, we need support.
No, I completely agree that it has to be a multi-stakeholder approach, and we need, different experts to come together. And I truly believe that, yes, a business can be built for the well-being and it has to be sustainable. So completely on that. Nanki, just picking up from what you said, when it comes to different stakeholders, I think the uptake of the digital initiatives, the integration of technology becomes a very important aspect in when we look at delivering better care to our senior citizens. So what are the initiatives that have currently you have seen that have been taken in the recent years, and what is the opportunity that exists in terms of integration of technology here?
So ultimately, Ritika, this is a business with touch, right? It is touch and tech together. Because touch is the empathy that is needed to be passed on to a senior citizen, right? As far as tech is concerned, there are a lot of businesses who are doing a membership model out there where they take care of all the needs of a senior citizen, starting from getting groceries to their healthcare. Where they, they charge a membership fee, and that way they have a defined revenue from the business has a defined revenue.
Right.
But in that defined revenue, they have to now continuously optimize tech, right? They have to make sure that security is taken care of, but there is a price to make a house secure enough where technology can be used. Are the citizens willing to pay that price, that capital expense, which could be 1 to 2 lakh rupees, which is required, right? That's a challenge. A lot of people will not do it, but then if you're taking up membership fee from that person, that means you have to have added manpower on the ground to make sure they're secure, because so tech has to be enabled from both sides. So I can put out an app, but will it be accepted, right? So I think again, I cannot tell you enough, Divya, how much awareness is required. And what we do is to enable that awareness is we do a lot of engagement sessions with seniors across, various societies. We meet them once in a week or once in 2 weeks, depending on where we go. We have this group of 15, 20 people who come and we talk about various subjects. That is where we talk about technology and how they can actually use it. We'll start with something as simple as, if you want to learn to blog, we'll teach you to blog, right? But at the same time, if you really want an integrated approach and you really want to be secure and use technology in the right way, please be ready to make that spend, right? Similarly, talking about fashion, we actually have a program and a tie-up with a model designer where we tell them, we will develop the portfolio, we will manage it for 2 years for you for a fee. That price sensitivity, and we give a discounted fee. And in fact, the tie-up with the designer is so good that we actually have a discounted fee for our members. So again, awareness, willingness, and need to spend, and the willingness to spend is important. Technology can do anything. We can do fashion shows online. We can do security. We can provide concierge services. We can provide medicine. We can do, I mean, we would rather leverage off existing Blinkits and other things than provide everything ourselves. But at the end of the day, if we are taking a membership, then we have to make sure it gets provided. And that's where technology is very important for us.
Yeah. No, I think you made the right statement that touch and tech together. And again, it brings us back that we need to understand the specific needs of the senior citizen population. But that also brings me to an interesting point, that what is the role of the caregiver when it comes to the senior citizen, care and ecosystem. So, Vaibhav, maybe if I can talk about that, because while we have our parents, the senior citizens, but we do have people who may be making decisions for them, the caregivers. So what is the role that they play? Also, Vaibhav, because you are a leader in home healthcare provider and you're operating across primary care, elderly care. So what are the specific maybe challenges that you have seen when it comes to in-home services for the elderly, and what are maybe some of the unique solutions that you have come up with in that sense?
So I tell you, there are 2 or 3 things which are very important. I think Nanki also mentioned that. So when you look at elderly, and I can speak from healthcare perspective because that's what we have been doing. People in India in general, or elderly more in particular, will only spend if they need it. So preventive care in general is not very high. I mean, culturally we believe like, okay, God will take care of us, right? So we are not like so big in preventive care, right?
Yes.
But if you look at elderly also, same thing, as she was mentioning about creating membership packages and subscription packages and things like that. People will take it only if they believe they need it. If they can get value for money, the price sensitivity piece, the value for money piece comes into play, right? So in healthcare, we have like around 60% of our patients are 60 plus, right? So it's a fairly sizable population which we have handled. And there are two needs. One, of course, people require geriatric care, where they require basically act of daily living and support around that. And there are quite a few people who are basically 70s, late 70s, early 80s who require support like that. Then patients who basically have had a disease like a cancer and things like that, and then of course they're recovering from there and need support lifelong, dementia, Alzheimer, those kind of things. And then of course people who come out of post-operative surgeries and things like that, and they require support for that, which is like medical need for a specific period of time, and the needs which are basically for lifelong or for a longer period of time. And both of those, of course, elderly require that. I think are in India, what is happening, the challenges or changes which you are seeing, India also has a lot of migrant populations now, right? So a lot of smaller cities, or even big cities, many cases, the children have moved away. They're either living in the country somewhere else, they migrate either within the country or migrate outside the country, right? So elder care in that sense becomes very important, because the decision making is basically with two people. So one, that elderly has to define their need, and that's of course their primary guardian, quote unquote, if you want to call that, or caregiver, has to basically go through that, approve that, and then of course who pays for it, right? Then also sometimes elderly pay for themselves, sometimes their children pay for them. So both of those kind of things are, those dynamics come into play. But I'm seeing from our perspective, of course, if it's post-operative care, they just need it. It's not optional, right? Because you need to rehabilitate and you require that. For geriatric care, for other kind of things, people probably take as delayed as possible and as little as possible, because they want to be independent, and they don't want to spend also in many cases, and that has to be taken care of. There, of course, you start working with the primary caregiver quite a bit. And the other thing which happens, even if you're creating like a subscription plan, elder care plan, which we are working with the elderly, there again, the reports have to go to their primary caregiver. They have to be kept into the loop. So of course, you take care of one person, and of course you keep interacting with the other person in the family, to make sure that everybody's on the same page and the right treatment is being given to the elderly, and the whole family is in the know of it. It's not very different from the fact that both of them stayed in the same house. I think almost 30 to 40% cases, they don't stay in the same house. I'll tell you, at least 15 to 20% cases where we are supporting elderly at home, we are the only ones in the home next to that elder person. And at least half of them are single now. Basically, the other person has expired, basically, right? So, I mean, there are many cases where we are supporting the elderly, we and the carer, our carer and our nurse, and the patient or elderly is there. There's no other family member actually who's living with them. So those kind of situations and challenges are there, but of course it has worked well. I think the need for this in-home service has been recognized, and of course more and more people are opting for it, because it makes your life very easy. So you remain in your familiar settings. So I mean, other thing which you see with elderly, they don't want to change their homes because they have been born and brought up and lived there for long. They miss their social circle, and social circle is of course very critical.
That they don't want to come out of.
They don't want to come out of it. So then, so they want to be there, and then of course, can somebody support them in a home? That becomes very important. So caregiving, if you see and other part of caregiving is that, for example, two of them are there, a couple is there, and one person is not well, other person becomes a family primary caregiver. Like my own father had dementia, my mother was a primary caregiver. And we had attendants from Portea in my own house, basically supporting my father. But then, of course, that care gets built on top of the primary caregiver. There, what Nanki was mentioning also becomes an important thing, that you can create solutions for caregivers. I mean, if you have primary caregiver who are basically handling a dementia and Alzheimer patients, they also require enough support actually. They require support in terms of training, they require support in terms of medical process, and so on and so forth. So there, what I see, a hybrid model where you can leverage technology and caregiving both, the touch and the technology together, becomes very important. And that technology, especially from elder care perspective, has to be weaved into the main solution. I don't see today's, at least in our experience, we don't see elderly willing to pay for technology separately. But if it's woven into the solution overall, and if it's contextual for them, right? Because, I mean, you said technology, like my father-in-law is like using GPay is using technology for him, right? Because he has only gone to the branch and used checkbook, right? He's like, today he converts to GPay is a big deal. For them to learn how to use WhatsApp was a big technology upgrade, right? So those kind of things are there. So if you can take easy to use technology solutions and build it into an overall solution. Even point of care devices. Like if you see, people earlier used to go to basically labs to give sample for checking their sugar, right? Then the glucometer came. Now this glucose monitoring patches are there, right? And
Absolutely.
we have done that for quite a few patients. The CGM and the ECG patches are there, and most of them are elderly. They're happily using it. It's a technology which basically makes them basically get value out of it in an easy way.
And
Correct.
better
So how do
quality
you
of
weave
life,
that
I
into the
think
main
convenience.
solution?
Yes, convenience translates to better quality of life, and
Yes.
you're right that they need to understand the value of it and they will be willing to adopt it. So I
Yes.
think that's a great point. And in-home healthcare services for the elderly, I think it's a great model, it's a great solution, and it works for both those who in need of care and those who are potential caregivers.
Correct.
Here, I would also like to talk about the community-driven initiatives or programs, right? They can make, the ecosystem work much more better. So, any community-driven programs that you would like to specifically talk about, or you would like, from a government point of view or from the philanthropist point of view, that should be initiated, especially for the elderly?
So I'm gonna answer your question, and I also want to add two little points to what Vaibhav said. One is,
Sure.
yes, I think the government should have like you have RWA clubs and you have allocation of hospitals and schools in a colony. You should have spaces for senior citizens to be able to get across their entire day, which are called adult day centers. I think which can be very, very helpful in the long run because you're continuously engaged and you're meeting your peers. I'm a big promoter of that, right? And
Yeah.
if the government starts just like Ayushman Bharat, I think everywhere it will start. The narrative will come in that there has to be a place for senior citizens. I want to
Yes.
make one point to what Weber was saying as my last closing point really is
Sure.
a great business opportunity for anybody who wants to take it up is caregiver exhaustion and how to deal with it. When Weber spoke about training caregivers, there's also huge exhaustion over there on how to, caregivers have to have a life of their own also. And a lot
Yes.
of times with my grandparents, I noticed that my grandmother's life was completely around my grandfather's who had a fall and broken his neck. Her life was done. Like
Hmm.
there was nothing left. So
Hmm.
caregiver, the primary caregiver exhaustion, addressing that need is very high. And secondly, when you deal with people at home, the other side of it is when there's nobody else to take care of, can you imagine the liability and the risk that all of us as companies take on to provide a hardly educated attendant, a nurse is still
Right.
better, to them inside the premises of their own house, where vicarious liability lies on you completely. If that person goes something wrong in his head and does something to the senior citizen, it is a very difficult task, but it is needed. What do you do? Somebody has to take it on, right?
Yeah.
So those are the 2 points. And yes, lastly is technology that we can roll out to seniors is like Google Maps. Nobody paid for it, but it's used by everybody. So you have to intertwine it in each and everything or aspect of their life, and then perhaps you'll get paid for it. Yeah.
Right, right. No, but great closing remarks. And maybe on this note, I actually wanted to harp upon two more things. Vaibhav had mentioned in the beginning the relevance part of it, that they should. So, and Nanki, you also just now mentioned that, we need to have adult day centers wherein they feel involved and they have activities to do. I think all this also gets related to the whole mental health aspect, right? So, maybe Vaibhav, if you can touch a little bit upon that from a mental health perspective, what are the initiatives that could possibly or that are required to be taken, because that is an ignored aspect but a very very critical aspect that needs to be taken care of.
I think that's a very valid point. And the most important part from mental health perspective, I think today's elderly, they may or may not be very happy talking to a psychologist or things like that. Because
Right.
I think there's always been a stigma around mental health in our country. And of
Yes.
course, 3 generations, 4 generations before this, of course, the stigma is much higher. So people won't like to do that. But that's where your point of driving the community engagement becomes very important. Driving social engagement becomes very important. Doing stuff where they feel meaningful becomes very important, where they find purpose in life. So I think most important thing to is that work with elderly and see if we can find a purpose for people who are 65 and above. So 65 to 85. I mean, what are the potential purposes in life at that age? And how do you create community activities around it, or how do you create initiatives around it which people can participate in, right? Actively. I mean, could be clubs, could be society clubs, could be community clubs which people could be part of and do that actually. So I think we need to think a little differently from a mental health perspective for elderly. And I think if a good engagement, good purpose solves most of the mental health issues, at least they don't arise, or arise probably on a very manageable level, right? It becomes, I think, loneliness is probably the biggest reason for it, right? So if we can create the community work around it, can we create community initiative around it? And as a society, as a country, we need to think to create purpose for them. And of course, these are things which will evolve, right? So there could be walking clubs, there could be music clubs, there could be temple clubs. I'm just thinking aloud, right? I mean, we had discussed this at one point in time, didn't do it, saying we'll run Gita classes, Gita sessions, and people who want to, are elderly who want to join can join, right?
Yes,
And
yes.
those kind of things, I mean, we didn't end up doing that, but I'm saying a lot of those things are there. Yoga for elderly, which is very different. The way you teach yoga to somebody who's like in their 30s and 40s versus you do for a 70-year-old will be very different, but it's important, right? So those kind of things I would say have to be looked at and have to be basically created as a movement. It's not basically my initiative versus your initiative. These are things which are there, right? Today, younger people, they can go to a pub, they can go to, they are XYZ things. Options are known to them to basically for recreation, right? For these are 5 things I do. If what I want to do on a weekend, I have 5 things to do, right? What are those 5 things which are there for an elderly person to do not only a weekend, through the week also?
Yes.
And then have enough outlets for that, for people to basically go and do that. So I think that's probably a different way of looking at mental health requirement for elderly.
For the
Of course,
elder.
traditional ways of doing, saying, okay, I have psychologists whom they can talk to and so on and so forth. In our experience, that doesn't go beyond first call actually. So even a lot of children say, okay, can you do a psychologist call for my parents? And we do that also, but doesn't go beyond 1 or 2 calls. Dementia counseling is something which works. Dementia therapy is something which works actually, where people can see real benefits. But I would say creating the purpose will probably take care of the mental health basically right at the beginning of it. So.
Right. No, I think the bottom line is understanding the needs of our elderly and customizing our approaches to address those needs from all stakeholders, which includes the government also, taking those evidence-based, decisions and policy recommendations. Just one last question to both of you. Are there any learnings that we can take? Of course, I know that India has its own unique challenges. The elderly have their own perspectives. There may be some taboos that are existing in India, vis-a-vis the other, fast aging, economies like a Japan or a South Korea. But are there any learnings that we can take from these economies, any initiatives that they would have implemented, and those can be taken as a learning and maybe customized and implemented in India? So that is definitely my last question. And both of you, any thoughts on this aspect?
I'll let Vaibhav answer it. Right, Vaibhav, go ahead. And I'm sure he will be pretty inclusive on that.
Actually, from our perspective, the way I look at it, and we saw that in change in last few years, right? So we have been talking about, for example, caregiving. A lot of these countries were not necessarily very open to that. But now I know in the last 3 or 4 years, like Japan, for example, has this program running with the Indian government where they're saying, let caregivers be trained in Japanese language. They have a program to teach them Japanese for 1 year. And they're getting work visa very easily to basically relocate there and work. So I think investing in a cadre which can take care of elderly is very important. Okay, India's situation will be very different because India, by the time India gets larger population of elderly, this also will be very, very lucrative market from business perspective, right? Because people who are people are in their 30s and 40s will, and maybe 20s now, will be like, there will be the 30 crore people in 2040 and 50, right? And these are people who will have all the purchasing power, right? So you create services for them. Of course, you create healthcare services, you create caregiving for them. So I think what Japan and South Korea are doing, they're investing in caregiving today. Okay, we as a country can invest in caregiving right now because even our numbers are not very large. We can also invest in community building right now. I mean, we also see that sad situation. Enough and more people in Japan die alone actually in their house and nobody comes to know, right? You come to know later. Those kind of situations you can avoid actually. So that's something which India can start working on now. And I would say creating the right community, creating the right purpose, creating the right cadre for caregiving. And there's a lot of work which is happening with different government bodies now, where we're saying that, okay, can we create people who are expert in taking care of dementia patients, the people who are expert in doing geriatric care. Actually, there's tremendous work happening in that space. So that's again something which we can invest in right now. So by the time another 10 years, 15 years, there's a caregiver cadre actually, and this which is there in millions of numbers actually, who can take care of the elderly as we grow in larger numbers. I would say those are 2 or 3 things which we can do and learn from these countries.
That's such a great way to look at it, Vaibhav, that, if there is something that is not going right in an economy, you can actually learn and, start taking the necessary steps much in advance. So I think that's a great point. And I will like to close it there. Some of the key takeaways from this conversation have been very, very interesting. The whole collaboration of touch and tech, the whole need to understand the unique challenges that our senior citizens face and customizing our approaches to that, initiating community building activities for our elderly is very important, and a holistic approach to physical and mental health support is the key. So thank you both of you for this very interesting conversation. I take away a lot, and we will be, kind of summarizing some of the key discussion points and share it with both of you. And I want this dialogue to continue because, as you said, this is just the beginning. A lot more can be done, but the fact is that we are recognizing the fact that there is a demographic shift that is happening, and we need to address the challenges of our elderly and make more favorable ecosystem of care for them. So thank you so much. Thank you.
Thanks so much. Thank you so much.
Thank you.